Okay, so then the first thing we might want to touch on is what do we mean by blocked care?
Block care is it's limited to doing your job, meeting your obligations, but without full engagement.
Hmm.
And I guess it's important to add it's a biological process in which caregiving systems shut down under the stress of lack of reciprocity between child and carer.
Yeah, so no, we're not in any way blaming people or saying, that's due to all types of psychological problems, or it's because of, yes, the lack of reciprocity. The child is not responding to care, then neurologically we start to shut that down. Caring starts to become increasingly difficult.
So we might see a parent that is taking their child to after school clubs. They're turning up in beautifully pressed clothes every day. They're eating a lovely diet. But when we perhaps talk to them about things they're doing with a child on a one-to-one and having fun with them, that sort of stuff might well be missing and not happening.
There's a strong sense of, isn't there, that I don't want to do this anymore. I'm doing it because it's my duty to do it, and I will keep the child safe, but I don't want to do it anymore. That's
Yeah, and sometimes that comes up, Kim, doesn't it, as in very overtly, I don't want to do this anymore. Sometimes you feel that, but the parent's not necessarily saying it. You kind of feel there's some kind of real pain or resentment towards their child, but they're not yet able to articulate that they're ready to kind of to check out almost.
So if you were having a kind of initial conversation with a parent, what kind of questions do you think you might ask them to try and find out if they might be experiencing some of those things?
I would probably start quite general with, what is your experience of parenting this child right now, and just first of all see what they come back with. Look for signs of enjoying, signs of still wanting to connect with the child, or conversely signs of not. You're looking at their general sense of, am I enjoying a relationship with my child? Do I want this relationship to continue? Am I feeling a lot of frustration, despair, hopelessness?
I think often it's trying to get parents into telling us the story of their kind of journey, if they can, around from wherever they started parenting their child, their parenting, and telling us a little bit about it, and then kind of becoming curious where it feels like the right times within that. Obviously weaving empathy all the way through, but trying to be a little bit curious about times when it's been really hard, or times when they have really enjoyed it. Sometimes I'll ask the last time they had a really warm feeling when they were with their child, and be really curious around that, and see if times spring to mind, or do they have to really search for the last time they had any warmth or enjoyment with their child. And then again, gently kind of building that story, and trying to kind of go down a few layers to feel what's really going on for that parent or carer in that situation.
You're also exploring for a loss of capacity to mentalize the child's experience, and their own experience for that. I'm thinking of carers who have talked to me about there's just something wrong with this child. This child, even to the extent of this child is evil, or some quite graphic language, or more moderately, there's just something wrong with this child, or she needs to get help, I can't do this anymore. But they're not able to reflect with you. Can we take a step back? Can we have a think about what might be going on for the child, what might be going on for you? That reflective capacity has gotten very, very small.
I think sometimes building on a simple question of why do you think your child is not responding? And if it's, well, he was born that way, it's too late, it's not curiosity, no wondering, and no sense of my involvement in that. I don't know. That's where I'm struggling. I don't know what to do. I'm trying this and this. I don't know what to do next. That's lovely if I hear that. But if it's over, that curiosity just not there anymore. It's a decision that it's hopeless.
And I guess too, building on what you both have said, is that if the sense is we just need to support the child in changing rather than in working on the relationship, then we really want to be more curious about that. We want the parents to be able, as you said, Kim, to be able to really look inside and to see their part of the tricky bits, their part in the change, their part in building a stronger relationship. And if they're able to think, yeah, there may be some things that I can do, great. If they're there, no, nothing's going to change until the child stops doing X, Y, and Z, then we know we're in a tricky place to be able to work relationally with them at this point in time. I think also another family springing into my mind, a family that really, the parents really struggle to receive empathy. So when I'm hearing about how difficult their day-to-day life is right now with this particular young person, and I'm really giving them some empathy around that, they'll kind of dismiss it or diminish it. Oh, okay, but it's fine. There's lots of people out there who are much worse than me, and I'm thinking that they're not able to stick with their pain and their story. So there's going to be a lot of work I'll need to do with them before we get to a place where they're going to be able to really think about their child and the child's pain and the child's story. I was thinking too about the parents that, particularly if it's a sibling group, and the young person that's the focus of the potential intervention or the potential therapy, if they're scapegoating that young person, if they see that person very much as the problem and having a significant negative impact on the other sibling group, kind of thinking about their child reading system and how it's really narrowing. So this young person is kind of the source of all their family's difficulties. That wouldn't be the end of my judgment, but that would really open up some curiosity around how they're really seeing their child at this time.
It's about reflectivity, about the ability for the parent figure to be able to reflect on themselves and the child, and or if they can use support to do that. Say
they're consistently defensive, pervasively defensive, and then you see a movement toward being open and engaged. Now, the open and engaged doesn't mean they're cheerful and friendly and warm and fuzzy. It means they're sort of open to their pain and engaged with me, staying with me in the pain rather than retreating back into defensiveness. Letting me help them with their vulnerability.
Okay, so I think that covers a lot of the stuff around how to kind of identify what kind of questions to ask. If you had identified that a family is experiencing blocked care, and you didn't think they were suitable for the trial, how could you kind of sensitively communicate that to them?
I guess my sense is that the families that have come into this trial are wanting a form of help that's going to be helpful to them. So I guess my starting point would be with authenticity and with honesty, to be saying, I really want to offer you something that will help, not offer you something that I think isn't going to be helpful for you and is going to lead to more frustration. And I guess I want to be really honest with you and let you know that I'm not sure this is the right thing for you right now. What I think might be helpful is blah, 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 but that bit around really speaking from the heart. So I think we need to lead with honesty and gentle and with lots and lots of empathy, and let them be disappointed, let them be frustrated, let them be cross with us if they need to be, and hold that and talk it through. But what I think our families don't need is to be given false hope, is to be given offers of things that aren't going to help them, because I think often that's happened time and time again. It's also really fair to say that many of us will start working with a family thinking that they are ready after quite a good bit of work, and sometimes we still get that wrong, and sometimes as you get to know somebody deeper, you're like, okay, I really missed something, and there's a lot of stuff that the parents haven't felt safe enough to share in those early days, and you realize that they were kind of in a maybe a passive compliance stage, or they really wanted the intervention, but when you really got to know them, there was much more there. So even the best assessments, with time, we realize that we get it wrong, so it's going to happen, isn't it?
Yeah, exactly.
So the key is to reduce the frequency of it happening.
Sure, absolutely.
So the obvious ones will be screened out.
Sure, yeah. But there are some that we're never going to get until we've really got a relationship going with them, and then we see it, don't we?
if a therapist accepts somebody for DDP, sometimes the work with the parent might go on for 6 months before the joint sessions start. In the right project, that's not a possibility. So what is happening during those 6 months is this parent may well be in block care, and so we can't start the joint work for a number of months. So this is hard, but we have to ask you to try to make an assessment. Do you think they'd be ready for the joint work in a much shorter period of time than 6 months? So there has to be some screening to set aside the parents who aren't ready to do the joint work in a realistic time frame. And realistic for the right trial is 2 to 6 weeks.